Hello, everybody. Hey, welcome to today's webinar, Mitigating Healthcare Waterborne Infections, the latest in compliance, science, and plumbing innovations. Before we begin, we're going to do just a quick poll so our panelists can see who's on, and then maybe we could even tailor some of this discussion towards what might be the most important in your area. I'm going to do that real quick. Kind of announce what's your role. I'm not seeing anything come up, so maybe this isn't working. Oh, changed my mind. All right, so we're at 29%, almost 30% facility managers. We've got some plumbing engineers, specifiers, contractors, infection preventionists, and nurses. I think you'll find this really valuable information. And then other at 33%. Oh, yeah, we're definitely ready for the second poll. What type of facility do you primarily work with? All right, that should be good. Drum roll. All right, 73% hospitals, another 7% long-term care facilities, 9% outpatient clinics, and 11% others. Great information for the others, by the way, so you're not going to miss out, trust me. All right, I think we've got one more poll. What is your primary concern regarding plumbing systems and waterborne infection risk? And drum roll. 17% regulatory compliance, 64% patient safety. I would have voted for that one too. System design and maintenance, and no others. All right, that is great. We've got a excellent panel ahead of you. I just want to do quick little housekeeping. You know how these things work. Feel free to put your questions in the Q&A. We monitor those as we go. Our speakers will save some time at the very end of this presentation to address any of those questions. And of course, any technical questions you may have, we'll address those as soon as possible. So you're not getting sound, whatever that may be. Also, you will get an email after this presentation's over on how to access this conversation with our panelists at any time you wish. So with that, I'm going to move on to our esteemed panel. Before I begin, I do want to have our expert panel just introduce themselves, who you are. We'll start with Spencer.
Hi, good afternoon, everyone. I am Spencer Johnson. I'm the Director of Water Safety and Management at Barclay Water Management, and I have over 7 years experience in the Legionella and water management consulting field. I've performed risk assessment surveys at over 100 facilities, and I'm a certified ASSE 12080 Legionella Water Safety and Management Specialist.
Thanks, Spencer.
Greg.
I'm Megan Canwright-Roscoe. I am the Director of Scientific Operations with Forensic Analytical Consulting Services. I'm based in San Diego, California. I have over 20 years of experience in industrial hygiene and waterborne pathogen risk assessment. I head up our water quality department here at FACS. and have been engaged in various projects doing risk assessment, Legionella risk assessment, waterborne pathogen risk assessment in both prevention and case or outbreak scenarios. And that's both for non-litigated and litigated projects. So I'm happy to be here. Thanks for having me.
Thanks, Megan.
Hello, everybody. My name is Brian Yelton. I am the president and owner of Inland Sales Group. I'm coming from a different angle than the other two panelists. So we are a manufacturer's rep company based in Illinois. So we are also heavily invested into plumbing. So I've been doing this for over 30 years and really into the Legionella and waterborne pathogens for close to 15 years now. So we've been doing a lot of CUs and a lot of other classes with the contractors and working with a lot of engineers and facilities to help design plumbing systems so the facilities can really work well with all their patients, all their inside people, and conduct all their testing and everything as the other two panelists work with after the fact. So we come in the beginning and kind of work through the whole process, but appreciate you being here and listening, and we'll go from there.
All right. Thank you, Brian. So I'd like to start our panel discussion with a very crucial, important topic that can help address problems before they can have an opportunity to occur: planning and designs. I'll start with Brian and kind of lead him off with a question. Facilities tend to struggle with plumbing in healthcare. Do you feel most facilities have an understanding of what is needed to mitigate waterborne pathogens in the plumbing system?
That's a loaded question, Greg, but yes, I think when you look back at one of your surveys and you say what's the most important, definitely the patient is most important. But when you look at what the other people do as far as engineering, as far as infectious disease control, and all those people, they all have their panels of what they're looking for. But I think the biggest confusing factor is that even though we're on a water management team in plenty of cases, they're not all having the same outcome. They don't understand how we accomplish things. And so we typically come involved and say, okay, how do we look at the plumbing system? We have to change how we do things. We have to look at flowing more water, getting our sensor faucets to actually flow more water when activated. And surprisingly enough, that's a question that comes up and people don't know they can do that with their facilities. So we do that. We talk about purging systems, hot water systems, testing, all those things. So I think the biggest thing that I look at, Greg, is trying to get everybody working together and setting some minor goals to create the big major goal, and that is to make sure your system operates properly. But it starts from the beginning with the architect and the engineer, all the way down through the end user that does the testing. So.
Great. Now, I know you mentioned water systems, so just real quick, I want to touch on designing a hot water system.
Yep, this is an ongoing process, Greg, and we deal with this a lot with engineers and trying to get an understanding. It's for, when you go back to when Legionella and where it all started back in the 70s. It's not that it started in the 70s; it was there, but we were designing plumbing systems that had tempered water running through the entire system at, 115 to 120 throughout the entire system, and which caused the majority of a lot of our issues within the plumbing systems and the biofilms and everything else. So now we're changing our mindset and getting our temperatures up higher to 160 degrees at the tank temperature distribution point. From the mechanical room, and then going to a master mixing valve, and then going down through point of use valves and thermostatic shower valves and all those things to tie them together, and then recirculating at a much higher temperature. So we get most of our piping out of that ideal growth range of 95 to 115 to 120 degrees. So this is an ongoing process. And when you have old infrastructure, this becomes a big issue on how do we do this, but it's something we have to be aware of and work towards going ahead.
Yeah, I agree, and especially you see this in the older infrastructure. Let's kind of slide into, I think, everybody's favorite topic, biofilm.
Yeah, it's I've used this slide, Greg, for I don't know how many years. It's just I call it the cartoon picture of the inside of the pipe. And, you know, everybody looks at biofilm and it's that nasty little stuff that's inside your pipe, but it's really, it's a living organism within. And I think we all have to be respectful of that, especially with our older systems and then even some of the new systems. I mean, you can go and, you know, set up a brand new hospital somewhere and then go through the setup on the entire system, do everything perfectly. And within 3 weeks, you're starting to build biofilm. And if you're doing the right things and carrying forward, you can help control it. And that's really all you're trying to do. And, you know, when we look at what's in it, every building is going to be completely different. But it just, as I talk to contractors a lot, and they cut out pipe and they look at the cross section, they just toss it away, going, ah, it's whatever, it's just old pipe. It's like, no, there's some life in there, and I think you have to respect whatever is within there and then do some testing to see what you actually have.
Yeah, and you have a great slide on biofilm, just
Yeah,
to
those are some nasty pictures.
see some.
You know, and we've all seen them. And, you know, the older buildings are going to have a lot more, no doubt. But the more we're flowing, the more we're operating and doing within helps. And I think the other big thing that we personally looking at, you know, codes and standards is trying to diminish our distribution pipe size. So we're not in, you know, having so much water sitting in our systems and be really aware of our active dead legs to make sure, you know, if you've got a wall hydrant somewhere that never gets used, we're making sure that it's being activated, or maybe bring it back around so we're getting recirculation to that point closer up. So those are all things we're looking at to minimize some of this nastiness.
Yeah, that's great. And it's also probably a good segue for Megan, kind of lead it with her with where some of these issues are really popping up.
Yeah, and that's a great segue because when we look at studies that look at the burden of waterborne illness in various settings, we know that biofilm-associated outbreaks account for a huge portion of the cases that we see. And Brian, I like what you said, that biofilm's kind of here to stay. It really is. I think there's a common, you know, misconception that we're going to be able to rid all piping of biofilm. And I think that's really unrealistic. It's about control, as you said. And I know we're going to talk about some of those control methods later. But biofilm becomes really important when we look at the burden of waterborne illness cases. And there was a study that was published this year by the CDC that looked at cases of waterborne illness, just reported cases, right? The ones that we know about. And between 2015 and 2020, and it looked at the setting that those outbreaks occurred in. And as you can see from this schematic or diagram from the study, that healthcare by far is most at risk and most susceptible to waterborne illness, with a very, very distant second in the hospitality industry. And then a lot of those cases are not just waterborne illness, but waterborne illness associated with biofilm, you know, organisms, Pseudomonas, Legionella, Mycobacterium. So it's really important to look at waterborne illness in healthcare, and it's important for us to control these cases. There were also a couple of studies. There was a study from Benedict in 2017 that looked at waterborne associated cases between 2013 and 2014. And we have limited data here. There hasn't been a lot of studies that look at multiple person outbreaks and look at the cost or the financial implications of those illnesses. But what we do know from the data that we do have is that Legionella accounts for the vast majority of multiple person outbreaks associated with potable water, drinking water. So 57% of outbreaks between 2013 and 2014 were due to Legionella. And you can see non-Legionella bacteria accounted for only 2%. So while Legionella may not be necessarily responsible for the most cases in the sheer number of cases, we know that they're certainly very responsible for the number of outbreaks that we see, the most outbreaks that we see. And then we see this kind of repeated in the CDC study from 2024 rather, where We look at Legionella as the causative agent, increasingly the causative agent in these waterborne outbreaks. And this was, again, between 2015 and 2020. There was a little bit of dip in 2020 when we had the COVID outbreak. This is suspected to be due to, obviously, we didn't have as much building occupancy. But again, by far, Legionella is responsible for these outbreaks more so than any other etiologies that we see in waterborne outbreaks.
I think this next slide will be very telling, in building design, what it can cost you if you don't.
And this is why it's important for us, right? Yes, we see increasing cases. Yes, and patient safety is obviously the most important thing that we're concerned about. The cost and the financial burden of dealing with outbreaks and the cost of healthcare, associated with these outbreaks is tremendous. So if your facility is dealing with an outbreak or case investigation, the cost of remediation and the cost of evaluating that is immense. Sampling can range from $5,000 to $30,000 per sampling event, depending on how many samples you're taking from your facility. And that's not even dealing with the consulting costs. Having a qualified person come in to establish a sampling plan and execute that sampling plan, $25,000 to upwards of $100,000 per outbreak or per event. We know that when, especially a healthcare facility has suspected cases, we have authorities having jurisdiction, like Department of Health coming in. They may have recommendations. They may have mandates that they implement. This little pictogram is taken from the CDC website, which gives recommendations to healthcare professionals about how to deal with, what interim measures to take when there are suspected cases. And up at the very top is restricting water. So if your facility is on restricted water and you're required to use bottled water, forced bottled water, it's thousands of dollars per day. Implementing point of use filters is another interim measure. And this is, again, interim control measures. This is before we even know whether the cases are associated with the facility, before sampling has been done. But those point of use filters can be up to $500 each. They have to be changed regularly, and again, can be thousands of dollars per month. And then there's disinfection and treatment. And one-time disinfections, a hyperchlorination or a hyperdisinfection, that can range from $8,000 to $15,000 or more per event. And then if we're implementing supplemental treatment, it can be anywhere from $50,000 to $200,000 per year, not necessarily involving infrastructure or equipment charges. And then if you need to make infrastructure changes, if you have to change the plumbing, if you have to change out equipment, those changes can cost millions of dollars. And so again, the burden of remediation and the cost of remediation is immense. And this doesn't even, consider the costs of internal staff. When you have an outbreak situation, your internal staff may have to drop their day job and respond. And so there's a significant cost associated with manpower and man hours, lost patients, coming into the facility. And then that's not even considering mitigating reputation and the public, impact to the reputation of the company. So that's just remediation. And then we can look at the, implications, the financial implications and healthcare cost implications of waterborne illness as a whole. So compliance is important to us. Patient safety is important to us. And obviously the financial impact is important as well. A study by Gerds et al. That was published last year looked at cases just in 2014. There were 7 million infections related to water sources. The study looked at drinking water, recreational water, which would be like spas and pools and lakes and things like that, and then non-recreational, non-drinking water sources. And there were 7 million infections just in 2014 alone from waterborne that resulted in waterborne illness. And of those 7 million, over 1 million were from drinking water, related to drinking water. Those infections resulted in 600,000 emergency room visits, almost 120,000 hospitalizations, and almost 7,000 deaths, to the tune of $3.3 billion in healthcare costs. So it's huge. When we look at drinking water alone, we know that Legionella in 2014 resulted in 6,000 hospitalizations. Non-tuberculous mycobacteria, over 35,000 hospitalizations, and Pseudomonas, almost 2,000 hospitalizations. So again, the impact to healthcare and the cost of this is huge. What we can see from this study is that When we look at Pseudomonas, NTM bacteria, and Legionellosis, those are biofilm-associated pathogens. So when we pull out those biofilm-associated pathogens, we know that the most hospitalizations and deaths are caused by those pathogens to the tune of $2.4 billion annually. So it's a huge impact. This is a critical issue. Cases continue to increase, and the cost of dealing with those cases continues to increase. There's also, regulatory fines and other issues that we may need to deal with if we're dealing with cases. If State Department of Health is involved, you might be getting violations or fines for failure to comply with orders. You may have an ordered closure. I don't know if any of you have ever dealt with an ordered closure, but that can have significant impact to the business. If there's occupational exposure that's alleged or possibly occurring, then OSHA may be able to get involved. They can issue violations under the general duty clause, even though there's no OSHA regulation, federal regulation dealing with Legionella specifically or waterborne pathogens specifically. It falls under the general duty clause. And there can be serious, willful, or repeat violations and fines that are implemented there. And then if you're in a state that has, or city that has, a regulation or public health ordinance like New York State or New York City, you can definitely have some fines and violations there for failure to comply or failure to register a cooling tower, anything like that. So again, there's a lot of areas where we can get cost impact from waterborne illness.
Great. Thanks, Megan. I'll open it up to the rest of the panel if you've got anything to add. But don't worry, everybody, we're going to go into regulations, standards, and certifications that can help your facility next. All right. So I'll start with Spencer on this side, just talking about some of the differences between ASHRAE 188, 514. You start seeing these things tossed all over the place, all the different guidelines.
Yeah, so we see quite a few different guidelines that are now out there for how to put together a water management program. The ones that people are probably most familiar with are ASHRAE Standard 188, which tells us which facilities need to have a water management program. The CDC toolkit, which they put out back in 2017, which helps facilities on how to tailor a water management program to their facility. ASHRAE Standard 188 is giving us the guidelines on who needs to have a water management program, but it doesn't do a great job at telling you how to put together that water management program. And that leads us to the CDC guidelines in their toolkit and ASHRAE Guideline 12. That gives you kind of how to put that water management program into practice, what the best practices are, and the control measures. The CMS memorandum, which we saw first released back in 2017 and updated in 2018, that's letting critical access hospitals know, long-term care facilities and hospitals. That's kind of the first guidance that we saw for facilities needing to create a water management program. And then the Joint Commission has also released their water management program standard that's in line with ASHRAE Standard 188, telling facilities again that they need to have a water management program that's focused on helping them mitigate their risk against Legionella bacteria and also other opportunistic waterborne pathogens. And we'll go into more on the next couple slides on what the differences are between ASHRAE Standard 188 and ASHRAE 514. ASHRAE 514 is the most recent standard that was released from ASHRAE regarding water management programs. And this is the area that we're kind of seeing facilities start to adopt their water management programs and adapt it to ASHRAE Standard 188, because it's going into more depth than we saw with Standard 188 and Guideline 12. Those were both solely focused on mitigating your risk against Legionella bacteria. And with 514, they've expanded it. They're looking for you to help you mitigate your risk against both the chemical, physical, and microbial hazards. And it's looking at more than just Legionella bacteria now. We're looking at those other opportunistic waterborne pathogens that were mentioned in the CMS memorandum and in the Joint Commission. So looking at Pseudomonas, non-tuberculosis mycobacterium, acanthamoeba, and Legionella as well. And we can go in the next slide in depth on what the main differences are. So like I was saying, it's expanding on those risks. Instead of if your water management program right now is just focused on Legionella, to meet ASHRAE 514, you're going to need to expand that. So you're going to need to think about the physical risks, which, spoiler alert, there's only one physical risk that they mentioned, scalding. Your chemical risks, you're going to want to think about, your supplemental disinfections that you might have, things like that, and then expanding that microbial hazard. So instead of just thinking about Legionella bacteria, now we need to think about these other opportunistic waterborne pathogens. And previously with Legionella, it's an aerosolized bacteria, so thinking about it in the water, but now there are additional waterborne pathogens that can be spread on surfaces as well. So that's something to consider. And then with the building risk factors, this is one where you might want to consider what buildings you have included in your water management program, because there's been changes made to that. So previously with ASHRAE Standard 188, they were looking at buildings that were 10 stories or greater. Now with ASHRAE Standard 514, they're looking at 6 stories or less. 6 stories or greater, sorry. So kind of thinking about, do you have any buildings that fall into that category? Maybe they now need to be added to your plan. And then ASHRAE Standard 188, they were looking at occupants that were greater than 65 years of age, because we knew that those would be high-risk individuals. But now 514 also wants you to consider occupants that are less than 2 years of age. So if you have a NICU, something like that, adding these facilities to your water management program. If you have supplemental disinfection in your facility, or your building is more than 50,000 square feet and has a potable booster pump, now you're going to want to include that in your plan as well. And then if you have an area that is doing surgeries, we've seen a lot of facilities where they have, a same-day surgery center that previously that building wouldn't have been meeting the requirements potentially of ASHRAE Standard 188. But now looking at 514, you might want to consider adding that to your plan. And then having long-term residential health services as well. So all these are kind of new updates to ASHRAE 514 that you'll want to review your plan and confirm that you're adding these buildings in, or you already have them in your plan to meet that. And then a couple of different changes. The elements that are controlled, like we said, previously we were just focused on Legionellosis, controlling that because of ASHRAE Standard 188, but now we're going to expand the scope and focus on the physical, chemical, and microbial hazards that are within your building water systems. So this is great because then your plan should be meeting both the CMS memorandum and the Joint Commissions. And then the last one kind of deals with parts of your plan, so different sections that you have within your water management program. It's talking about the water system descriptions. So previously they mentioned that you want to have your endpoints and the processing equipment and components. And now they're going a little bit further on what you need to have. So they want to have where your water quality report that you get from the municipality. Most facilities are getting their water from the city. So including that water quality report, that'll tell you what disinfectant the city is using, all the tests that you're taking on, they're taking on your water. Is it a surface water source? Is it a groundwater source? You'll be able to get all that information, and it'll be good information to have in your water management program. The identification, location, and description of all points of use throughout your facility, and then the location and description of all water received, processed, including associated equipment with that.
Thanks, Spencer. I think this next slide also on ST 108 is going to be very interesting to this audience.
So this is one of the newest standards that we've been seeing for water management programs to incorporate into your water management program. This is AMI ST 108, and it's focused on the water for processing of medical devices. So it's addressing the water quality at the point of use, cleaning, rinsing, and disinfecting and sterilization of medical devices and the steam that's being used for medical device reprocessing. Previously, before this, we hadn't seen people involving, their central sterilization processes within their water management program. But this is one of the big updates that we're seeing for facilities needing to include this in their water management program. And in AMI ST 108, they make a couple of different recommendations on what steps you should be taking in your water management program. So in ST 108, they outline 3 categories of water. The first type of water is the utility water. This is the water that's coming in directly from the city. So this is what we usually think of as your domestic water when we're talking about your water management program, but it gets a little bit confusing, or your potable water, it gets a little confusing here because in ST 108, they refer to that as your utility water. So this is the water that's coming in directly from the city. It's usually untreated. And then there's critical water. That's going to be your water that's going to be used for the high level disinfections. So that's end process when you're treating these medical devices, when you're doing that reprocessing. This is that last step, the critical water that's being used. And it's usually undergoes some sort of treatment. So usually with a DI system or a reverse osmosis system. And that's your critical water. And then your steam is going to be your vaporized water from your boiler or generator near the sterilizer. In ST 108, what they define that you need to do in your water management program is you want to include information about your central sterile system into your water management program, perform a risk assessment on that area. And then you're going to want to also make an update to your water management program team. We're going to want to add someone from that central sterile department to your water management program so that we have them involved in the WMP. And then they outline 2 different types of testing that you should be doing. There's what they call a performance qualification testing. That's the first type of testing that you need to do. And then there's a routine sampling. And they outline within it different water quality parameters that you're going to need to be testing for each of these categories of water. And what we've been recommending to facilities is we're seeing right now, we're in the beginning stages of this. This standard was released last year, but a lot of facilities are in the process right now of adopting this. So we're seeing facilities start to perform that risk assessment, add members of the central sterile department to their water management program, and then perform this first type of testing, the performance qualification testing, to make sure, are they in line with what those requirements are in AMI ST 108. And then once you pass that, kind of moving on to the routine sampling, taking the sampling based on the frequencies that are defined in ST 108.
Great. Thank you, Spencer. These next slides, I'm going to go back to Brian. And I think this will be really helpful on who should be getting certified and the training that's out there for your facility.
Thanks, Greg. Yeah, it's when I got started in this field many years ago, starting to talk about Legionella, it was everybody didn't know what to do, how to do it. There was no certifications, and many times I'd go into a hospital grouping and I'd be with a bunch of people, and the first question was, well, what makes you an expert? And at that point, none of us that are talking today had anything to put behind our name. And that's where I'll carry the ASSE flag across the field here on this one, because I was involved in ASSE before, and then I was part of the working group that created 1280, which we'll talk about shortly here. And like I said, I've been on 1280, just recertified last year, as with everybody else. But there's several other certifications within the 12,000s with ASSE, and really the driving force here, Greg, and everybody, is to make sure you're getting the people involved in your organization, people outside your organization that come in and work in your building, and all these other people that have touch points within your facility are aware of all the issues that can happen. And are you going to learn everything? Absolutely not. But you're going to give an opportunity to get information through it. So when I look at 1210, it's like, okay, we're going to talk about construction and management maintenance personnel. Very few facilities actually get this done. And it helps when you're tying your water management team together to have all these different guys. So 1210 is the first one. And then we go from there on to 1220, which now we're talking about construction and maintenance. And now we're looking at, okay, how do we look at the guys doing maintenance work? How do we look at construction? And it's not just plumbing. Sometimes we got to look at HVAC. It's air control. All these other things that, as Megan talked about, it's not just Legionella. We got to talk about all these other pathogens that we're within. So getting some information so they understand what this is and what they're dealing with is important. And then the one that gets more and more closest to us as we get into the 1260s is, looking at plumbers and pipe fitters and all that. And then it break down 1260 even further, the next slide, Greg, is where we get into the 1261, where we really dial it down into plumbers, 62 pipe fitters, and the sprinkler fitters. And this is where I spent a lot of time with union halls and contractors, and in many cases, we look at these guys and saying, hey, please get certified, because the hospitals and facilities should be hiring contractors that have people that are certified to these standards. Because then therefore they, at least they've got the basics done. But unfortunately, I think in a lot of cases, when we talk to contractors that are doing a lot of hospital work, they're not certified. They don't know the exposures. We're the one training them, or in many cases, the three of us are come in after the fact and said, now we have to collect up and figure out what we're going to do to fix it. And then ultimately the last one here, Greg, is going to 1280. And that is where all three of us are certified to. Like I said, I was on the working group that created this because it was important to us to get it done. So we could also bring this to the forefront to say, hey, we're going to help you. We're going to help create a water management program and bring it all together. So I think in a nutshell, ASSC is a standard community that works within all of our plumbing products. So, when we make a faucet or a shower valve or a mixing valve, they're all going to have an ASSC standard that it's meant towards. So why not have products or standards to help us as an industry carry forward that ties into our building management? So that's where we're tying those together, Greg.
Awesome. Thanks, Brian. Yeah, this training is important, and I'm sure some of you are trying to remember all these. Don't worry, we'll get that email out. But like Brian said, I think there's some growing knowledge of these certifications, but definitely not widespread and common. I'm going to wrap up with water management plans. The term water management plans or WMPs have come up a few times, in this presentation. So I just want to kind of address this with our panel, the good, the bad, the ugly. And I'll start with Spencer.
Greg. So as far as what is a water management program, if you're not familiar with what's involved with creating a water management program, ASHRAE Standard 188 and ASHRAE Standard 514 have outlined for you what steps you would want to take to put together a water management program. The first thing you want to do is conduct a risk assessment at your facility, doing a survey of the entire facility, figuring out how many points of entry do you have, how is your hot water heated and stored, how many recirculation lines do you have, what types of fixtures do you have, like Brian was mentioning earlier, do you have automatic faucets that you potentially need to set up to purge more often, do you have laminar flow aerators, making sure that we're getting water moving throughout the building. Then you want to think about who you want to have on your water management program team. Usually we would recommend having someone from the facilities department, having someone that's really familiar with your building's water system, including someone from infection control that has a good understanding of the patient care types throughout the facility, having someone potentially from environmental services, because these are going to be the people that are in the rooms on a regular basis. They can help with the flushing, turning on all those fixtures. And then now adding someone as well that is involved with the sterile processing if your facility has a sterile processing department. You want to create flow diagrams that are going to show a simplistic diagram that are going to show where the water enters the building, what types of point of uses do you have for your cold water, what temperatures is it being heated to, all of that information so that there's an easy, simplistic drawing that anyone from the facility can look at and have a good understanding of what's going on. And then from your risk assessment survey, you're going to want to determine what are your critical control points. Where do we need to control the growth of bacteria? So where throughout your domestic water, your utility water, your cooling towers, those are a big risk point. Do you have any decorative fountains in your facility? And then for each point that you've defined as a critical control point, you want to define different action items that'll help you mitigate that risk. Maybe that's cleaning your domestic storage tanks on an annual basis, checking the hot water temperatures to confirm that you're at the temperature that you're expecting to see at your facility, or raising the hot water temperatures of at your tank itself. And then for each of those action items, you want to define what your control limits are. So what ranges are you expecting to see for those temperatures? And then if you find that you're outside of those, you want to make sure that you're implementing corrective actions. So, checking recirculation loops if you find you're outside of those temperatures. Maybe you get a positive result from sampling your hot water tank, then needing to do a cleaning, things of that nature. The area that I would say that we see facilities struggle with the most is making sure that they have a procedure in place for verification and validation of your plan. We see a lot of facilities, especially after the CMS memorandum was released, we saw a lot of facilities put together their water management programs, and then they were like, great, I'm done. I did it. Nice job. And then we saw them just have this plan, and it was a binder. It sat on a shelf for 5 years until the Joint Commission released their water management programs standard. And at that point, they did, they were like, oh man, we haven't looked at this plan for 5 years. We do need to do something with this. So verifying and validating your plan, meeting with your water management program team on a regular basis, talking about what steps are we going to take for verification and validation? Are we going to do Legionella sampling to confirm that all of our actions are working? Maybe you're taking disinfectant residuals at fixtures throughout the facility, taking a sample, at the point of entry, seeing what the level that you're getting from the municipality is, and then taking samples throughout to confirm, has there been enough flushing going on? Is that water being moved through the facility? Or maybe taking some samples for HPC levels, heterotrophic plate counts, getting an overall bacterial level, trying to confirm if you're within the limits that the EPA has set. So that's the big area that I would say we see a lot of facilities needing to perform that verification and validation, confirming that their plan is actually working, and then doing that annual update and having the documentation on it. And we've seen that there's a couple of states that have released regulations for water management programs. The first one that released regulations is New York State. They were the first state, they were the pioneers for releasing these regulations, and they released them back in 2015. So this is requiring healthcare facilities to have a water management program in place. And they also have really strict regulations for cooling tower owners to have plans in place for those as well. They have very clear requirements on how many Legionella samples you need to take and how often you need to perform Legionella sampling. And it's in line with ASHRAE standard 188. Then we've seen 2 other states add regulations as well. New Jersey, just recently, September 12th, 2024, passed a requirement that's going to require a large array of facilities that are meeting ASHRAE standard 188. So hospitals, hotels, large apartment buildings, these are all going to need to implement a water management program within the next 2 years is what it's looking like. And they don't have any requirements right now for Legionella testing within that. And then Ohio also recently released requirements for surrounding Legionella bacteria. So they're requiring hospitals to implement a water management program if they haven't already, again, in line with ASHRAE standard 188. And they require that Legionella samples are taken on a biannual basis. They're not as clear as New York on how many samples need to be taken, but they are requiring that Legionella samples are taken.
Great. Thanks, Spencer.
Yeah.
Hey, Brian, I want to switch to the other side and kind of get your take on water management plans.
I love this slide because that's the one that we kind of talk about all the time, because many people aren't even aware of the situation. And to what Spencer just spoke about with the codes, when you talk about any waterborne pathogen, there's just a lack of coding across the country. And I think that's what everybody's waiting for, is somebody to create this massive code that's going to tell everybody what to do. And there isn't going to be one. And, and the hardest thing for every facility to understand is you can spend millions of dollars from the day it was designed to the day it was built and still have a problem. And I think that's where we got to look at. We're using a water that's coming from somebody else. You don't own the water. You have to deal with it as it comes in the building. I think that's the biggest thing. The state of Illinois came out and created a law for nursing homes that they have to test for Legionella once a year. But that's where the law ended. There's no water management program. There's no tell them how to do it. There's none of that. So in healthcare, yes, we got a jump start. We're getting caught up, but on the other types of facilities, we're still way behind. So there's a lot of opportunity ahead, and I think there's a lot of growth within all of our facilities that we need to really be working towards taking our treatment seriously. And to Spencer's point, the one thing that I work hardest with what the end user is, you need to do an as-built drawing of your building, and they all hate it. It's time consuming, but it's the one that really shows where all the problems lie, all the dead ends, all the cut pipe, all that stuff that's 100 years of what shouldn't have happened, but it's there.
But it's still there, whether you want to or not. All right, so we're coming up on the last 15 minutes. So I just want to just really briefly talk through some short-term and long-term remediation.
You want me to take that one?
Sure, Spencer.
All right. So for short-term and long-term remediations, we've split it up into two types. Usually when we're seeing a short-term remediation, this is a facility that's had taken samples, they've gotten positive results, or maybe they're in an outbreak situation. And in this situation, you kind of have a couple of different options on how you can respond. The first that we see is pretty common is a hyperhalogenation. So that's doing a hyperchlorination at the facility, increasing your chlorine level. The downsides to this are that it can be extremely corrosive to your plumbing system. It's usually disruptive to patients because during the time that you're performing that hyperchlorination, most of the time that level is going to be above the EPA's limit. So you can't use the water system at that time. And then it's also costly. It requires a lot of labor because you need to flush every fixture throughout the facility. And it's a really time-consuming process. It requires a lot of manpower. And it's temporary. We've seen recolonization of Legionella bacteria within 7 days of performing a hyperchlorination. So this is why it's considered to be a short-term remediation. Another option, like Megan was mentioning earlier, point-of-use filters. They're very effective at filtering out Legionella bacteria. They do work great. They can filter out Legionella bacteria and other waterborne pathogens. The downsides to them are that they need to be changed out, like Megan was saying, depending on what type of filter you've had, between 30 days and potentially up to 6 months. And it requires, again, a lot of manpower for installing each of those filters throughout, and they don't carry a disinfectant residual. So you're only safe in the areas where you've installed those filters. Anywhere where you're not installing those filters, that could still be a risk point for you. Another option is a thermal disinfection. So this is when you would raise the temperature of your hot water system to kill the Legionella bacteria throughout. This is something that the CDC, when they released their Legionella sampling toolkit, they no longer recommend doing this as a short-term remediation because they found that the recolonization period afterwards is so quick that it's just not a recommendation. And you'll see it's pretty similar to doing a hyperchlorination. It's temporary. It can be disruptive to patients because since you have to raise up that temperature so high, you can't use the water at that point. It's going to be a scalding risk. And it's also labor intensive, and it can be costly on the infrastructure. People see leaks, plumbing seals are failing at those high temperatures that they weren't meant to, see. And then the last option is flushing. So this is just kind of opening up all your plumbing, getting that, moving water throughout the building. And it's great because it can help move sediments and biofilms and decreases the water age, and it can help increase the disinfectant residual. But one thing to keep in mind is you're limited to what the level is that you're seeing from the municipality. So if you're seeing a really low level coming in from the municipality, you're going to see that level dissipate as you move throughout your system. And you're not, that's the level that's the most that you would expect to see. So those are kind of your options for a short-term disinfection.
Oops, skipped one, sorry. There you go.
And then looking at long-term remediations, there's a couple of different options that are out there. So sodium hypochlorite, a chlorine disinfection, this would be similar to doing a hyperchlorination, but keeping it below that EPA limit, having a chlorine injector and increasing your disinfectant residual. It can be, things to keep in mind are that it can be corrosive to your plumbing system, and it can create disinfection byproducts, which are mentioned in ASHRAE Standard 514. And sometimes people complain about taste and odor concerns potentially because you increase those chlorine levels and then people start to say, oh, my ice tastes like it came from a pool or something like that. And then another option is copper silver ionization. We've seen a lot of facilities start to move away from this. New York State is no longer recommending this as an option. It's highly corrosive. It has a pH restriction of 8, so it can be hard to maintain that always. The plates need to be cleaned on a regular basis with acid. And we found for some facilities that's a problem because they just don't want to have this acid on site to make sure that they're cleaning those. And it has limitations with the dosage limits. So for copper, you have a dosage limit of 1 part per million. And for silver, you have the limit of 0.1 ppm. And with those limits, we've seen a lot of facilities where they're at those limits and they're still unfortunately getting positive results. And so you don't have room to move with that. So we have seen a lot of facilities moving away from copper silver ionization. Chlorine dioxide is another option. One thing to note here is that chlorite, you need to have someone on site that's measuring that level daily, and it decomposes rapidly. It's not going to carry in your hot water system well. So that's something to keep in mind with chlorine dioxide. And the last option that we have listed for long-term disinfection is monochloramine. It's something that's been used in drinking water as a disinfectant for over 90 years. I'm coming from Boston and we have MWRA water. We use it in our municipality. Philadelphia uses it as well. So it's a widespread used disinfectant. It has a lower levels of disinfectant byproducts than chlorine. And what we like to think of monochloramine as a lazy disinfectant. It stays in the hot water and that residual stays in the water longer. So we see it throughout both your cold and your hot water system. It's giving you that good residual throughout, and it's going to be less corrosive to your plumbing system than chlorine or chlorine dioxide. So we've seen it be really successful with Legionella bacteria.
Thank you. I just kind of want you to wrap up. I think either Brian, Spencer, Megan, what's promoting the growth of these waterborne pathogens. Then we'll get into some Q&A.
Sure, Greg. I can start, and then everybody else can chime in there too. This is just kind of a short list of some of the main things that are causing the issues of waterborne pathogens, but I really think it's not one, or it's mostly all of them in a lot of cases. And I think, as Megan said, we're looking at a lot of different things of in the past. How do we deal with it? Where do we go from here? And then Spencer saying, how do we, we look at all these different treatment things. And I think at the end of the day, we need to look at everything. And no two buildings are going to operate the same way. Some buildings are going to have some of these problems. Some of them not going to have any of the problems. And I think it's just we need to look at each one and each building separately. And I think that's, something to take home today from anybody that's listening, is that just because it happened over here doesn't mean it's going to happen over here. It may. And just because you treat it one way doesn't mean it's going to work in your building either. And I think you guys would agree to that, correct?
Absolutely. I think, every building is different. That's why that risk assessment is so important. Brian, you mentioned having as-built or some kind of drawings to be able to look at it. That's a critical element, having those plumbing diagrams that are up to date, as up to date as possible, and then doing a building walkthrough. Understanding the water system is such a critical part of the risk assessment. And I think a lot of questions that I get are, well, what should I focus on most? Should I focus on temperature or disinfectant or flushing? Like, what's the most important? And it really depends on your facility and what the risk factors are that are presented in your facility. and what options you have available to you as well. You know, there could be limitations in manpower. And I know flushing is a huge problem for some facilities. So implementing things like self-flushing faucets, you know, having some options and technologies available. So combining not only your internal manpower with options from vendors, you know, that's all going to be dictated by your water management plan, which is going to be dictated by your site-based, site-specific risk assessment. So it's really important to have that multidisciplinary team approach to be able to get that right.
Yeah, I completely agree with Brian and Megan. The risk assessment is probably one of the most important parts of having your water management program, because then you've identified all those high risk areas and you know where to focus on. And then once you've brought together that water management program team, these people can come together, collectively decide how to respond to any issues that arise.
Great. Thanks, Spencer, Megan, Brian. We do have a few questions popping in, so I'm going to use up our last time to try to get to as many questions as possible. This one, I think, great for you, Spencer. Do you think that ST-108 is going to ultimately result in needing steam generators in place close to the processing location?
That is a good question. At this point, I'm not sure. We haven't seen a lot of facilities yet starting to test their steam systems. I mean, if you've seen the requirements of ST-108, they are very, you know, some of the elements are hard to achieve just by getting your steam that you're getting from the boiler system. So I do think that we could start to see, facilities moving in that direction. But at this point, it's hard to say. AMI right now is in the process of creating a companion document to ST-108. And so we're hoping that that will give us more information on how exactly to implement ST-108, because we're seeing a lot of facilities that are in this beginning stages, not exactly sure where to go from ST-108.
All right, great. Thank you.
If I could just add to that,
Yeah.
I think we need to see with time whether implementing the aspects, the control measures in ST-108 actually result in better patient outcomes. So as time moves forward and as it's adopted more readily in facilities, we'll get more information about patient outcomes. And I think that's really important information before healthcare facilities are going to be willing to make huge infrastructure changes like that.
Absolutely. Here's an interesting question. Please discuss the use of iodine as a long-term solution. Dentistry has successfully used low-dose iodine to control biofilm and dental unit water lines.
I can take that unless anyone else wants to. So yeah, iodine has been successful in, especially in preventing mycobacterium infections in dental unit water lines. However, those dental water lines are a lot different than a giant plumbing system with large volumes of water. And so iodine, as far as I know, has not been implemented in potable water, as in like the premise plumbing. It might be something that is useful for, you know, medical equipment and cleaning medical lines, but I have not seen that widely implemented in healthcare outside of dental facilities. Others might have other experiences, but it is true that iodine has been successful in helping to minimize waterborne illness in those specific dental water lines.
Okay, makes sense. And this going back to water management plans, the next couple of questions, you know, one, and I don't know if you want to elaborate on it more, but where you've seen it, but you know, just want to mention how important documentation and record keeping is for everyone involved.
Documentation is huge for water management programs. We always say if you don't have documentation to prove that you're doing what you say you're doing, then regulatory agencies, they won't believe you that you're actually performing those action items. So that is one of the main things that you need to have with your water management program. For every action that you're taking, have a work order system in place, have a checklist, have some sort of documentation to back up that you're actually completing these action items, so that once a surveyor comes in and they're looking for that information, you have that documentation to prove it.
Yeah, especially if you're doing testing yourself within your own facility. and train your people and give them the education of what they're actually doing. And it's amazing how many hospitals I've gone into where I talk to the people who are doing the testing and they don't even really know what they're getting the water test for. So just that whole education process, and then you're going to get better documentation. And like Spencer says, if you don't have documentation, you have nothing. And the first thing that the CDC ever did say, I mean, 188 is basically, you better write a book, and that's it. And then, we'll go from there.
That is,
All right.
sorry, one more last point. That is also where the vast majority of findings that I see coming from Joint Commission inspections is related to documentation.
Agreed.
Awesome. All right, I'm being time conscious here, so I do want to give a huge thank you to our panelists, Spencer, Megan, Brian. I know we tried to squeeze in probably like a entire 3-day session here into 1 hour. So great job. Before we conclude again, a recording from today's webinar will be available soon. Just keep an eye out for your email. And thanks again for attending today's webinar. Have a great day. Appreciate it. Thank you, everybody.